Tanan lagi i-discuss na. F to F na, sure ko.
Ano sa ako sa cellphone, Beth?
Nag-record ko. Ano man?
Ano pa ako dito sa picture?
Ano nag-record lang ko na?
Okay, so our topic today is about reproductive life planning. Can you hear me well?
Yes, Ma'am.
What about the the slides? Can you see it?
Yes, Ma'am.
Okay, good. Kinandaot kita akong laptop this morning. Okay, so reproductive life planning. It is our topic for this morning, which includes all the discussions an individual or couple make about whether and when to have children and how many children to have and how they are spaced. No? So when you say reproductive life planning, it's about deciding on whether whether to have children or not, and if ever they want to have children, how many children do they want, or how many children to have, when to have it, or how they are spaced. Because even though you are really financially ready, emotionally ready to have children, but it's not that easy to take care of them and to give them the best quality of life and care that they deserve, no? So mo na di po pwede nga you can bear children every year kaya dili mo matuunan og pansin kada isa nila. So mauna nga they have to be spaced, you have to be very ready, and you have to carefully plan your parenthood before you want to have any children. Unang importante kaayo ang reproductive life planning. So in reproductive life planning, you could often it is called as family planning, no? So reproductive life planning is also called as family planning. So what is family planning? Go ahead. So family planning is the planning of when to have children and the use of birth control and other techniques to implement such plans. Because if you have a partner, if you are married, no, and then of course one of your way of showing your affection, your intimacy is of course the reproductive act, no, or the sexual act. So it is inevitable that you will have children or you will get pregnant. So in order for you to follow the birth spacing that you want or to plan your family towards responsible parenthood, so it may involve the use also of birth control and other techniques so that your family planning, your plan, no, for spacing your children will be accomplished. So other techniques of family planning include sexuality education, prevention and management of sexually transmitted infections, preconception counseling and management, and infertility management. So when you say responsible parenthood or family planning, what comes into your mind is just the birth control, diba? The pills, the IUD, the vasectomy, the ligation. Mura na masuod sa kasagari hunahuna sa ordinary nga person when we talk about family planning, birth control methods. But it's beyond that. It's beyond birth control methods because supposedly in family planning, your responsibility as health teachers, health educators, is also to educate your clients, your patients about sexuality education. Atong discuss about human sexuality, about reproduction, you should be able to discuss it to them in simpler terms, in layman's term. So sexuality education, which it also involves the prevention and management of sexually transmitted infection. So tuluan po nimo sila unsaon nga di sila takdan og sakit nga STI or STDs. That's part of responsible parenthood. That's part of family planning supposedly, no? And then preconception counseling and management. So before pa maburos na kay counseling and management dapat. And then infertility management. So appeal po diri ang mga management or treatment if the family or the couple is not able to bear children. What else? Okay, no? So, dili lang siya about how to space children. Dili lang siya about birth control methods, sexuality education, prevention of STIs and STD, counseling. But it also involves management, no, on infertility. Kanang couple nga di maboros, couple nga di makaanak. So, unsay management na nila, that is included in the family planning or responsible parenthood nga kuan na to nga mga implementations or interventions. So family planning is sometimes used as a synonym for the use of birth control, no? Munang paglayman ka, pag dili ka health care provider or tawagan, a healthcare worker, when you hear the word family planning, you would define it as birth control lang. Because most of us, when we talk about family planning, we sometimes use it as a synonym for birth control use. But it often includes more than other techniques. Appeal pa na siya sa family method, no? Family planning is most usually applied to a female-male couple who wish to limit their number of children or to control the timing of their pregnancy. So kanang mag-control ang timing sa pregnancy, that is what you call as spacing children or birth spacing. Okay? So again, nga naman mag-require tag birth spacing because raising a child requires significant amounts of resources. Daghay resources involved when you raise a child. Di man na siya murag ka ng even gali ang mananap, no? Even gali ang it's quite costly to have dogs, no? So how much more for a human being? It requires a lot of resources, which includes time, social ni mga resources, no? Malimit yung mga social activities when you have children because you have to take care of them. You have to be with them always. And then financial, environmental resources. You should have a very good and well-protected home when you want to raise children well. So daghan kay siya, it requires significant amounts of resources. Mo na nga, parents should be ready whenever they want to have children or whenever they decide to bear a child or to have children. So planning, therefore, can help assure that resources are available. That's why family planning is very important. No? It can help assure that these resources are available before you'll have children or before you decide on having children. So these are the guiding principles now in family planning method. As a nurse, as a healthcare provider or healthcare worker, we should determine our own beliefs first. No? Because if you are against family planning, then how can you be an advocate for family planning? So you have to determine your own beliefs first. If dili ka uyon anang family planning, dili uyon ng imong culture and imong religion about family planning, then don't engage yourself, no, in teaching about family planning or in working as a nurse, which involves health education and implementation about family planning. So bangit ta kag trabahoon as a nurse nga dili mag-involve sa family planning. So you have to determine your own beliefs first, but of course, no, as nurses or as health advocates, isa gini sa atong advocacy ang responsible parenthood of family planning, because we are trying to uplift the health and well-being of everyone. And planning your family well, planning the family well, or when we encourage patients and clients to plan their family well, we are also uplifting their well-being, their health as well. So mao na part it po siya sa atong responsibility, pero kung hugot gud imong determine imong belief, imong principle sa life nga di ka ganahan ng family planning, then don't involve yourself in teaching it. Pero apil gud siya dapat sa atong responsibility as nurses, no? And then sa mga natong guiding principles, determine your own beliefs first. Kay basig ma-judgmental unya ka. Di po ka mag-judgmental ha kung ikaw firm believer of family planning, imong client pili. So we have to respect all our differences. Muna bitaw nang ingon si Madeline Lininger, natay mga cultural diversity kuan dapat awareness. Kaya i-respect yun natin mga cultural diversity sa itong mga clients, sa itong mga patient, no? So anyway, let's go back to the guiding principles. Determine your own beliefs first. Never advise a permanent method of family planning. In fact, we will not advise any method. We are just going to present to our clients what are the different birth control methods, what are the advantages, the disadvantages, what is the success rate. Di ratataman. Then it should be the couple who will decide which family planning method they are going to use. No? And pero ang ato aging emphasize nga dili ta mo advise of permanent method. Permanent method kanang vasectomy, tubal ligation, ngano man. Base nun yan karon, determined na kasi nga dili kami ganahan mga anak mo nang we choose the permanent method. Unya later on in life, after 10 years, after 5 years, maka-decide sila nga, uy, gusto pa dahil ko mga anak. Gusto pa dahil may mga anak. And it's too late na kay permanent method na ilang gigamit. Di na sila kaanak. Oh, so basig ma-regret nila ilang decisions later on. Muna, as much as possible, do not advise a permanent method of family planning. And of course, you have to make sure that the informed consent is available, no? And also, the method is an individual decision of either of the mother or of the wife or the husband, no? And maayo kung magkakuan sila, maka-decide sila duha on the same method. Okay, uy. So, in determining the methods of contraception, kaya daghan may methods of contraception, daghan methods of birth control. When I say contraception, preventing pregnancy. So, birth control na siya. So, there are many methods of contraception, no? And the individuals or couples should choose a contraceptive method carefully. Ako nagingon ka ganina, individuals or couples should choose a contraceptive method carefully, considering the advantages, the disadvantages, and the side effects of the various options. So these are the important things to consider now when choosing the methods of contraception. The personal values, the ability to use a method correctly, kaya basig pili-pili silang method, unya di na kabalo saon paghimuan na, paggamit ana nga method. Then how the method will affect sexual enjoyment. And then financial factors, no? Kaya basig mag-choose silang method na mahal. They are not capable of spending for it. And although sa health center, namin yung mga free method, like free condoms, free IUD insertions. So, depende kung karakuan ba ka ng indicated ba po na sa iya. Yung may uban contraindicated ang mga birth control methods, no? So, financial factors, the status of a couple's relationship, prior experiences, and future plans. So those are the most important things to consider when deciding which contraceptive method is to be used. So what should be an ideal contraceptive method? So an ideal contraceptive should be safe. It should be 100% effective. Kundi mga 100%, nearly 100% effective. It should be compatible with the religious and cultural beliefs and personal preferences of both the user and the sexual partner. It should be free. Kaya isa na may i-birth control. Ang user na siya. Then ang iyang partner, okay. Apil po dapat siya nga kuan. Ang say tawag ani. Napo siya preference anak na method. And then it should be free of side effects or little side effects. Convenient to use and easily obtainable, affordable and needing few instructions for effective use, and free of effects after discontinuation on future pregnancies. So what are the different family planning methods? Okay, first we have the barrier methods. Unsa man ang barrier method? Magbutang kag barrier, magbutang kag wall, magbutang kag stopper, para dili mag-meet si sperm o si egg. Okay? Muna siya gitawag barrier method so that the sperm and the egg will not unite, will not be fertilized. So these are now the different barrier methods. You have the condoms, the diaphragm, the cervical cap, the contraceptive sponge, the spermicides, and the IUD. So first you have the IUD, which is a mechanical barrier method. No, because it involves the mechanical device, no? Kani siya. This is only one type of IUD, kaning copper wire. Man siya isok-sok sa uterus, no? So an intrauterine device is a molded plastic device and some containing some containing copper, like this one, the copper T, nga klase ng IUD na siya copper wire, no? So this intrauterine device will disrupt the normal uterine environment so that it will prevent implantation. Okay? So the IUD prevents implantation. it alters the mobility of the sperm and the ovum. The IUD is best inserted after delivery and during menstruation. Saka na siya insert during menstruation when the cervix is open and after delivery. Okay? Common complication ani niya is excessive menstrual flow. Ang common problem ani niya is expulsion of the device. Also is that it does not protect the client against STI or STD. Even if you have an IUD, dili mapugngan nga matakdan ka og STD or STI in case imong partner na ay STD or STI or sexually transmitted disease or sexually transmitted infection. Okay? Ang side effects niya includes uterine infection, uterine perforation, and ectopic pregnancy. No? Kay pwede mangyapon nga na instance nga mag-meet si sperm o si egg, no? And then diha na hinuon siya sa ovary. Sa fallopian tube mo develop. Mo nakita og ectopic pregnancy. So it could result in ectopic pregnancy. The major indication for use of IUD is parity. Parity. The number of times nga nanganak na ka. Kaya if isa pa imong anak, dili na siya indication for IUD insertion. Isa pa man nakabuo. Ano mag-IUD man ka? So the major indication of the use of IUD is parity. Ano kung daghan na kag-anak, na dapat i-control na din na siya. So pwede na ka mag-IUD. Okay? So our health teachings to our clients who is using IUD is to have monthly checkups and regular pap smear or Papa Nicolau smear, no? Sa iyahang gynecologist. Monthly checkup and regular pap smear. Okay. What did we put? Drawing out. Illustration sa condom. Okay, so another family planning method is the use of the condom. Okay, of course, you all know naman siguro how a condom looks like, no? Or siyang balloon, naala siya lubricant. Okay, so a condom is made up of latex. So pag nakay latex allergy, di ka pwede ka gamit o condom. So choose another family planning method, no? So it's made out of latex, no? It is put in an erected penis or lubricated vagina because we also have a female condom. Okay? So kung male condom, ibutang na siya sa erected nga penis. Kung female condom, ibutang na siya sa lubricated nga vagina. So it prevents the sperm to enter the uterus. Okay? As what I've said, na a female condom, no, which has a higher protection than that of the male. Okay, but what is most commonly used is the male condom. Okay, so among the contraceptive methods, it's the condom which will help prevent sexually transmitted diseases or sexually transmitted infection. Sa tanang family planning method, ang condom ray dili pud 100%. Kay na mapud uban mga viruses nga gagmay kaayo nga mugawa sa condom. Tapoy uban nga magisi ang condom, so pwede gihapon mo leak ang mga kagaw. But generally, condoms will prevent you from contracting STIs and STD. Okay, so it does not only prevent pregnancy, but it also prevents STIs and STD, ang condoms. Okay, so another family planning method is the diaphragm. Our contraceptive method is the diaphragm. So, muna siya ang diaphragm, ha? It is a dome-shaped rubberized material inserted at the cervix to prevent sperm getting inside the uterus. Okay, so the good thing about the diaphragm is that it is reusable. Kada mag-coitus, pwede siya gamiton. Pero limpyuhan siya after use. Ha? Di pwede na siya pwede nga i-reuse nga way limpyo-limpyo. It is reusable, but it should be cleaned and checked from time to time. That's why our health teachings to our clients who wants to use diaphragm or who is using diaphragm is of course to maintain proper hygiene. Proper hygiene sa kaugalingon o hygiene po o cleanliness po sa iyang diaphragm. And then check for holes. Basig na libustot ang diaphragm, makalusot gyapon ang sperm, no? Check for holes. It must be refitted in case of weight gain of 15 pounds. Ha? Di ka pwede basta-basta makagamit og diaphragm nga mopalit lang ka and then imong gamiton because it needs to be fitted. Lain na siyang sizes, depende kung unsay size para sa imo. So kinahanglan pa na siya i-fit. And then if you gained weight of more than 15 pounds, you need a refitting again of your diaphragm. Kay basig lahi na nga size nga diaphragm imong kinahanglan. Ha? So it must be in case of weight gain of 15 pounds or more. And then it should be kept in place for about 6 to 8 hours after using. So para gyud sure ka nga inigtangtang nimo walay mulik nga sperm padong sa imuhang egg. So it must be kept in place for about 6 to 8 hours. It is contraindicated to clients having frequent urinary tract infection. It is contraindicated to clients having frequent urinary tract infection. Okay, another contraceptive method is the cervical cap. So mura gyapon siya og function sa diaphragm, no? It creates a barrier between the sperm and the egg. So the cervical cap is more durable than the diaphragm. It could stay in place for more than 24 hours. And sa diaphragm, no, kinahanglan pa ka magbutag spermicides or contraceptive jelly bago gamiton. Sa diaphragm, pwede ka magbutag contraceptive jelly, pwede po dili, no? So you don't need to apply spermicides when using diaphragm. But it is contraindicated to women having abnormal pap smears. Okay, another contraceptive method is are the spermicides, or the foams, which are most effective. It could be in the form of foams, jellies, creams, but the most effective of them are the spermicide foams. Then another contraceptive method is the contraceptive sponge. Okay, so mora gyapon siya og function. It prevents also the entry or it creates a barrier between the sperm and the egg. Okay, so another form of contraceptive method is the hormonal family planning method. Okay, so hormones na pod ang iyang target para ma-prevent ang pregnancy. So we have the oral contraceptive pills, the hormonal injections, implants, and the lactation amenorrhea method. Okay. So man na siya ang oral contraceptive pills. No? These are contraceptives or contraceptive pills to prevent ovulation. So mo yang i-prevent ang pag-ovulate sa babae. Because if dili mag-ovulate ang babae, walay egg cell nga moadto sa iyang fallopian tube. So walay i-fertilize ang iyang sperm kung walay egg cell nga niadto sa fallopian tube. Kaya kung nag-ovulate ka, di ba pag mag-ovulate ka, na ay egg cell nga matured ovum or matured nga egg cell nga ilagpot atong ovary padong sa fallopian tube. And dito na din na siya maghuwat sa fallopian tube sa isa sperm para i-fertilize siya. Pero kung walay ovulation nga mahitabo, of course, there's no mature ovum that will go into the fallopian tube and no fertilization will take place. So that's a function of your contraceptive pills or oral contraceptive pills. It will prevent ovulation. So it will prevent ovulation by inhibiting the anterior pituitary gland production of the FSH and the LH, the follicle stimulating hormone and the luteinizing hormone, which are essential for the maturation and rupture of a follicle. Okay, so ang oral contraceptive pills, it could be a pill which contains both estrogen and progesterone. Pero may uban nga naay mga cardiovascular diseases and other mga diseases nga dili pwede sa ilang estrogen, naapoy pills nga progestin lang ang content, progesterone lang ang content. So anyway, why do these pills contain estrogen and or progesterone? Because estrogen will inhibit follicle-stimulating hormone, which is responsible for the maturation of an ovum. Progesterone, on the other hand, will inhibit the luteinizing hormone, which is responsible for ovulation. So, muna siya ang function sa imong oral contraceptive pills. So, your oral contraceptive pills contains both estrogen and progesterone to limit the production of FSH and LH. That's why an ovum will not become mature and or there is no ovulation that will take place. Okay? So, the oral contraceptive pills is 99.9% effective. So, hapit siya mag 100%, no? Okay, so naay lain-lain nga klaseng oral contraceptive pills, no? Naay 21-day lang nga oral contraceptive pills, napoy 28-day nga pills. So kaning naa sa ato ang kuan pila may kabuok? 1 2 3 4 1 2 3 4 5 6 7 8 so 28-day nga pill ning naa sa atong illustration. Pero napoy 21-day pill lang, 21 na kabutang nga pills ang imong i-take in 1 month, no? So, if it is a 21-day pill, kung 21 ra na siya kabuok sa isa ka bulan nga pills, nga tabletas, so you are going to take the first pill on the 5th day of menstruation. So, 1st to 4th day, 1 to 4 days, wala kay i-take nga pills. Magsugod ka sa first pill on the 5th day of menstruation until mahurot nimo ang 21 kabuok. So that's until the 26th day of menstruation. If kaning ang imong i-take kaning pareha sa ato ang ansayngan ani illustration nga 28-day nga pills, then take the first pill on the first day of menstruation. Okay? Take the first pill on the first day of menstruation. Now, nurse ko, kabalo ko unsa na mga oral contraceptive pills. Or, tangotanan ka sa imong friends, ay nurse makaday no, unsa may pills maayong gamiton? Are you going to, are you going to self-medicate? Or are you going to recommend an oral contraceptive pill to your friends, your family members? No, we are not doctors. We could not prescribe medications. Even if we know, no, the mechanism of action, kay di ba gitunan man yun sa inyong pharma, mga mechanism of action, mga dosage, indications, contraindications sa mga medications, but still we are not allowed to prescribe medications. So even if family members na nimo, amiga na nimo, di ka magpatakag prescribe og medications, labi na pills nga numan. As what I've said, delikado ang pill sa babae nga naay cardiovascular diseases such as hypertension. So kinahanglan gid na siya i-check sa doctor, tanan niya i-assess siya overall bago ma-decidean kung pwede ba siya mag-pills o kung pwede siya mag-pills, unsa nga klase nga pills ang para sa iya. Ha? So, di mag-finiling nga mura doctor, ha? Di magpataka o prescribe o medication. Pero one second. Okay, so again ha, if it is a 21-day pill, take the first pill on the 5th day of menstruation. If it is a 28-day pill, take the first pill on the first day of menstruation. If a pill was forgotten, take 2 tablets the following day. Ha? Pero if katulo na siya if duha na kaadlaw iyang na forgotten, then stop the pill first and do another family planning method, and then visit the doctor before you go on taking your pills. So ang adverse effects lang aning oral contraceptive pills is breakthrough bleeding. Now, what if the mother who is taking an oral contraceptive pills wants to get pregnant? Kaya di ba pag nag-pills ka, pirminigil ka mag-take ana, monthly on a cycle. So, isa ka pa kada month. Hangtod nga gusto ka maboros or gusto ka mo-stop. Now, if you want to get pregnant, okay, wait for 3 months. And then another 3 months. And if unsuccessful, before consulting the OB-GYN. Okay? So, wait for 3 months. Na di sa ka mag-pills. And then if you don't get pregnant, you have to consult the OB-GYN. Okay, again, the contraindication for pills, contraindicated siya to mothers who are chain smokers, no? Okay, it could affect the cardiovascular aspect of the mother. It is contraindicated in mothers who have hypertension, diabetes mellitus, extreme obesity, and thrombophlebitis. Again ha, contraindicated siya sa chain smoking, hypertension, diabetes mellitus, extreme obesity, and other cardiovascular disorders or cardiovascular diseases. Okay. Now, ang side effects sa pills resembles hypertension. Kung sa may side effects niya, abdominal pain, chest pain, headache, eye problem, severe leg cramps. If these side effects occur, then there should be immediate discontinuation of the pills. Diretso gyud dayon siya i-discontinue ang pills. Di na siya mo take sa pills. Then visit the doctor or consult the doctor. Okay? Now, in case a mother is taking an oral contraceptive pills for almost a long time and plans to get pregnant, she would wait for at least 3 months before attempting to conceive, no? What's 3 months before attempting to conceive to provide time for estrogen and progesterone levels to return to normal. If after 6 months the mother did not get pregnant, that's the time to consult the OB-GYN. Sabi ko yun kaganina nga, wait for 3 months, and then wait another 3 months before going to the doctor. Maghuwat sa ka 3 months, di ka maburos manggudayon pag humani mo undang sa pills, no? Kaya wala pa na ma-return sa normal level imong mga hormones. So, wait for 3 months. Within 3 months, di ka maburos. Pag di ka maburos within 3 months, wait for another 3 months. After 6 months, ka maburos, that's the time that you consult the OB-GYN. Okay, basig there's something wrong now with your fertility. If a new oral contraceptive is prescribed, the mother should continue taking the previously prescribed contraceptive and begin taking the new one on the first day of the next menses. For example, karon giresetahan ka og progesterone pills only. Di ko familiar sa mga brand sa sa pills. Or naman ko ng mga Diana, whatever. Di ko particular sa brand because I'm not using it. And what I am most familiar of is the pills in the health center ng walay brand. Yung generic name lang. So, for example, itagaan ka progestin pills only. And then on the next month, ningon imong doctor nga, okay, another type or another brand of pills will be prescribed for you. Prescribean ta ka og lain na pod nga klase nga pills. Dahil nga brand na pod. So, what should you do? What should you teach the mother pala? Okay, sa ingon ni mga mother nga, ma'am, hutdon sa nimo tong imuhang karaan nga pills or dili karaan ka ng previously prescribed nga pills kay sig napay nabili, no? Imo sa na siyang hutdon and saka pa nimo i-take, no, ang hutdon niya katong nakuha na nga pack dili masig na siya stock nga 30 packs tanan, ayaw tugod na tong 30 packs kato nang nakuhaan na nga pack. So ingon sa nimo siya hutdon sa nimo tong nakuhaan na nga pack na mahuman siya sa isa ka cycle bago nimo i-take ang first pill sa imuhang new nga contraceptive pills. For example, ang iyang pill A nga gi-prescribe sa una siyang Dr. Pill A na pa siya nabilin nga tulo ka pills. And then gi-prescribean siya sa doktor og bag-o na pod pill B na pod. So, basig ihang himuon, take din siya sa pill B. Wa niya hot na tong 3 ka pills, dili. Iya siya tong hutdon tong nabilin nga 3 nga pills sa iyang karaan nga pills bago niya i-take tong bag-o na pod gi-prescribe nga pills. Katong bag-o nga gi-prescribe na pills dito niya i-take to sa first day of the next menstruation kung 28-day pills to siya. Kung 21-day nga pills dito to niya i-take sa 5th ang pilmero nga pill dito niya i-take sa 5th day sa iyang menstruation. Okay. Then discontinue the oral contraceptives if there are signs of severe headaches, as that is an indication of hypertension associated with increased incidence of cerebral vascular accident and subarachnoid hemorrhage or stroke. Mo na delikado ang pills. Okay, it could lead to hypertension. If you have hypertension, it could lead to stroke, cerebral vascular accident, and subarachnoid hemorrhage. Manalita mapataka og prescribe, hindi ta doctor, no? So again, if you forgot to drink pill for 1 day, then take 2 pills the next day. If you forgot to drink the pills for 2 days, then stop the pill and wait for the next menstruation. Di na siya effective kasi boboros ka. So, if you forgot to drink 1 pill for 1 day, then take 2 pills the next day. But if you forgot to drink pills for 2 days, then stop the entire pill and wait for the next menstruation and take another batch of pills for that month. Again, the adverse reaction of oral contraceptive pills is breakthrough bleeding. Okay. So another family planning method is the injectable, no, nga hormonal family planning method. Okay, the most common injectable nga family planning method is the Depo-Provera, or we call this as the dipomedroxyprogesterone acetate, or the DMPA. So this injectable contains progesterone, no, the Depo-medroxyprogesterone acetate. It is given intramuscularly every 3 months. So meaning 1 injection will prevent pregnancy for 3 months. Given ni siya intramuscular or IM every 3 months. Now when you give this as intramuscular, one of your most important nursing responsibility is never to massage the injection site. Do not massage the injection site because it may decrease the effectiveness of the Depo-Provera.
Oh.
Okay, has a never massage the injection site because it may decrease the effectiveness. Okay. Now, another hormonal method is the implant method. Ang pinaka-common na ginagamit is the Norplant, no? It is, muna siya ang Norplant. Muna siyang implant na hormonal method. So, mura siya og matchsticks kada, nga capsule rod. So, it's a matchstick-like capsule or rod. Capsule na siya actually. Mura lang matchstick tanaw, no? Unom na siya kabuok. So, 6 na siya ka matchstick-like capsules or rod which contains progesterone. So, hormone gihapon iyahang sulod, no? Mabitang gitawag siya hormonal nga method. So, it contains progesterone. It is implanted subcutaneously. Usually in the arms of a woman. It is implanted subcutaneously and it will protect the woman from pregnancy for 5 years. Diba katong kaganina, katong injectable, 3 months lang siya nga makaprevent of pregnancy. This one, it's for 5 years, kaning implant. Okay? So, we also have the natural family planning method. So, it does not involve any any buying of hormones. It does not include buying any materials for contraception, pero natural lang siya. Okay? So we have, by the way, namadiri ang kuan. What di ay? Isa po di ay kakuan, no? I forgot to mention. Isa po di ay ka-hormonal family planning method, pero at the same time natural siya is the lactation amenorrhea method. Kanamitang after delivery, mag-lactate ka, mag-breastfeeding ka sa bata, it will also prevent ovulation for a few months only. So, dili kay siya effective, no? Kaya waka kabalo, basig maburos lang kag kalit kay nagsalig ka sa lactation amenorrhea method. But most usually, for a few months after delivery, pag nag-breastfeeding ka, dili pa ka mag-ovulate, di pa ka dugon mo na mag-amenorrhea ka. So, in that way, ma-prevent ang pregnancy. Okay? So, again, let's go back to the natural family planning method. You have the cervical mucus method. You have the basal body temperature. You have the counting days or the calendar method. You have the sex without intercourse. And then you have the withdrawal. So, unsa man ang cervical mucus method, which is also called as the Billings method, no? So, imuhang tan-aon every day ang imuhang cervical mucus, ang imong vaginal fluid. No? If your vaginal fluid is not clear and it is not stretchable, then that means that you are not fertile. You are not ovulating. So, it's safe for you to have sexual activity during that time and you will not get pregnant. If you are ovulating, you would know that because when you look at your cervical mucus, when you look at your vaginal discharges, medyo clear siya, watery, and very stretchable. Okay, that means nga ovulating ka. So, you will not have any sex during that time if you don't want to get pregnant. Okay, if you are going to have sexual intercourse and then you are ovulating, you are fertile, you will surely get pregnant. But this method, kaning mga natural family planning method, is not that effective, no? Kay, pwede man nga, okay, di ka makipag-intercourse karon kay nag-ovulate ka, kinabantayan nimo nga clear, watery, and stretchy ang imong cervical mucus. So, ugma na, or the day before. But remember, the sperm and the egg could survive, no, for how many hours? For long periods, for 2 to 3 days. So, bisan pag wa ka nag-ovulate ka gahapon, karon nag-ovulate ka, pwede gyapon ka mag-fertilize. Nag-ovulate ka karon ug mawala nagkoitus ta ugma, pwede buhi pa tong imuhang kuan, egg cell. So, pwede pa gyapon mag-fertilize sa sperm. So, di gyapon ka kumpiyansaan, but it will somehow, if done correctly, it will somehow prevent pregnancy. And then you have the basal body temperature. I have already mentioned to you this before, no? And using this, you are going to check your temperature every morning before arising. And then you will get your average ng temperature, no? And you will know when you're ovulating because in women, ovulation causes an increase of 1/2 to 1 degree Fahrenheit when you are ovulating. So, moinit ka gamay when you are ovulating. But then again, that's not quite effective because basin din ng temperature change lang ka. Abi ni mo nag-ovulate ka. Or abi ni mo wa ka mag-ovulate ka, wala mo increase imong body temperature, pero wala lang gid siya mo change when you're ovulating. Because our bodies are like that sometimes, no? Sometimes we don't respond to changes. Sometimes we respond. So, manadili kay siya effective. Okay? So, of course, lactation amenorrhea method, aside from being a hormonal method, it's also considered as a natural family planning method, no? Because when you are breastfeeding the infant, when you are breastfeeding the newborn, you will secrete prolactin nga hormone. Ang prolactin, mo na siya ang mo-inhibit sa ovulation. Mo na siya ang mag-prevent sa ovulation. So, when mother is breastfeeding after delivery, usually, wala na siya yung menstrual cycle for 4 to 6 months. Kaya kung mag-bottle fed ka, 2 to 3 months ang imong amenorrhea taman. Kung mag-breastfeed ka, 4 to 6 months ang imong amenorrhea. Di ka dugon for 4 to 6 months. But then again, dili po siya kaayo effective. Kaya I've heard of some women na nag-lactation amenorrhea method, then nagpadayo na yung amenorrhea pregnant na siya. So, wa siya moagi og menstruation. Abi niya effective pa iyang LAM or lactation amenorrhea method. So, after 4 months, after 5 months, ning boros na pod siya. That's why you have to use whatever family planning method you're going to use. Make sure that it is done accurately. It is implemented accurately. And if it is natural family planning, then it is best that you use 2 types of natural family planning para effective yun siya. Okay? And then we have also another method which is a combination of the Billings method and the BBT, which is the most effective natural family planning method. I-combine mo tong cervical mucus method o gatong basal body temperature method. You call that as the symptothermal method. SYMPTHO thermal. Symptothermal method. It's a combination of the Billings and the BBT method, and it's the most effective natural family planning method. And then you have the withdrawal or the sex without intercourse. Saan man na siya, ma'am? Okay? Pwede man good ka, walay penetration. Okay? So, pwede ka coitus interfemora or coitus interfemoris. Okay, between the femur lang. Between the paa lang. Between the thighs lang. Taman ang penis. Okay? So, mo na pasabot sa one way of sex without intercourse. Pwede po kissing lang, no? So, basta wala intercourse na may tabo. And then we have withdrawal or coitus interruptus, no? This is the least, kanabitang there is penetration, pero right before ejaculation, the man has to withdraw the penis. That is a very ineffective method, the least effective method among all family planning methods. Nga naman, pwede ma-delayed ang withdrawal, no? Nag-ejaculate na dahil siya before niya na-withdraw. So, wala ka po yung pulos, no? Or pwede po yung pre-ejaculatory fluid, wala ba siya mag-ejaculate, pero na siya yung mga pre-ejaculatory fluid that may contain sperm, live sperm, so pwede gapon to siya makaburos. Okay? So, mo na siya nga least effective method, ang coitus interruptus or ang withdrawal. Then we also have what we call as coitus reservatus or careza. It is sex without ejaculation, sex without ejaculation. Meaning, the couple remains in the plateau phase of the intercourse for as long as possible, but they have to avoid orgasm and they have to avoid seminal emission. Medyo lisod po na siya, no? So that's why it's best if you use katong barrier method or mechanical method na IUD or the hormonal method or the natural family planning method na cervical mucus, PBT, and also we have the counting days method or the calendar method or the rhythm method. Okay, you have two ways, no, of the calendar method or the rhythm method. We have the standard days method.